Today, we're focusing on shock and not just any form of shock. We're going to focus on hypovolemic shock and what to focus on for the CCRN exam. So, with hypovolemic shock, what we need to think about is our tank is empty or it's just not filled the way that it should be. And that really means that our vessels, our body, it doesn't have the same amount of fluid that it had prior in the vasculature. So when I say that, I mean someone could be third spacing. So you could have burns, right? So yes, they have the right fluid. It's just not in the right places. Someone could have a massive hemorrhage, right? And be bleeding out. That's another form of hypovolemic shock. And then another form of hypovolemic shock could be someone who's severely dehydrated, like someone who is in diabetic ketoacidosis. So those three patients all look vastly different, but they're in the same form of shock, which is hypovolemic shock. Now, for the CCRN, what they like to focus on is these numbers, right? And these are the ones I'm talking about right here. So what we see is a low cardiac output. And that makes sense because I don't have the appropriate volume or the fluid, right, to pump to the rest of my body. So cardiac output is going to be low. These patients get tachycardic because they try to compensate, right? So if I have a patient who has low cardiac output, they try to compensate by increasing their heart rate to get that cardiac output up. But a lot of times what happens is because they're so dehydrated or there's so much fluid loss, they can't. The next one that we see that's very common is going to be these filling pressures. So low filling pressures. And you're like, what the heck is a filling pressure? The easiest way to think of a filling pressure is literally the pressure that's going into the heart. And you got to remember our heart has two sides, left and right. So what that's saying is on either side of the heart, the filling pressures are low. So the CVP is on the right side, the PAOP is on the left side, and both of those are low. So if those pressures are low, it makes sense that my cardiac output would be low because essentially I'm not getting enough blood in to pump enough blood out, hence why my cardiac output is low. The last one we see is this SVR, and that is actually high. And you're like, that doesn't make sense. That should be low. But this is our body's way of compensating. It compensates by increasing our SVR. And our SVR literally stands for your systemic vascular resistance. And that's essentially your pressure that your vasculature is trying to increase. And if you think about it, these patients are going to try to clamp down or squeeze to increase their blood pressure. So that's our body's way of compensating, or increasing the perfusion to our vital organs by increasing this SVR. So having a high SVR is our body's way of compensating. So these are the three main things that you're going to see tested on for the CCRN.